All right. Hi, Brittany. How are you doing today?
Hi, I'm good. And yourself?
I'm good. My name's Sierra. I'll be your nurse today. So today we're just going to do a little skin assessment just so I can get familiar with your body. Also so you can ask me any questions from, any bruises that you noticed or didn't notice before, any soreness that you might have in certain areas. So I'll start from your head and then I'll go all the way down to your toes.
Okay.
And in between, if you need to stop me and ask me any questions, just let me know, okay?
Perfect.
All right. So I'm going to start in your head area.
Okay.
I'm just going to use my hands and just feel around. I'm just checking for like any bumps or any like tenderness, any spots that might feel soft. Do you have any moments of tenderness while I'm doing this?
No, but I'm getting a free massage, so it's fine.
Have you noticed any lesions or anything like that that you might have felt that wasn't there before?
No.
Okay. Right. That's good. Now I'm just going to check your scalp just to make sure there's no discoloration or any redness.
Okay.
That's pretty good. Now, have you noticed any increase in hair shedding?
Just up front, but it could be because of stress, right?
Yeah, absolutely. But it doesn't look like it's too thinned out or anything like that. It's pretty even on both sides, so it doesn't look like you're paying attention to one side more than the other. You don't have any bald spots that I see, which is good.
That's good.
Do you have any baldness frowning in your family?
Baldness?
Yeah.
My grandfather, but I think it's from old age.
Okay. So now I'm just going to check the back of your neck.
Okay.
I'm just looking to make sure that you don't have any lesions, no soreness or anything like that in the area. When I do this, does it feel sore at all?
No.
Okay. And then I'm just going to check it behind your ear area. Have you had any lumps by your ear?
No.
Okay.
Do I have one now?
No, you do not. Have you felt any tenderness in your ear area?
No.
Okay.
My ear rings a lot.
Your ear rings?
Yeah. Means people are talking about me, right?
Not that exactly, but
Could it be something else?
it could. But as far as that, you would want someone more as far as like a hearing doctor that would just go and check inside to make sure that your drum in your ear isn't damaged, or sometimes you can have too much too much impact of like the earwax and stuff like that. Sometimes people use Q-tips that we aren't supposed to be using that
really?
pushes towards your drum.
Ear drums.
Exactly. And then it can cause temporary hearing loss, or it can cause infections in the ear. So we usually try to stay away from putting those in your ear.
Interesting.
But we can definitely talk to your doctor about that. So I'm just looking at the back of in the back upper area just to make sure that the hair is distributed the same on both sides. If you have any bumps or bruises. Do you have any soreness in your back area?
No.
Okay. And I'm just going to check the lower back area. Have any soreness while I'm doing this?
No.
Okay. All right. And then I'm just going to come to the front area. Now we're just going to look at your face. I'm going to look straight at you to make sure that your eyes are even, your mouth area is even. There's no drooping of any sorts. Looks pretty good. You have a few beauty marks in your face.
Yes.
Okay. Have you noticed any changes in your face lately that wasn't the same before? Maybe like increase in acne or anything like that?
Yes. I didn't break out as much as I did 2 weeks ago,
Mm-hmm.
but I changed. What's it called?
Your skin regimen?
Yes.
Okay. And has that been helping?
Yes.
Okay. All right. So I'm just going to check your eyebrow area. They're even. I'm just going to check here. Do you feel any tenderness while I'm doing this?
A little bit.
Any painful? Is it painful, or is it just more just me pushing into it?
Yeah, just pressure.
Okay. I'm just checking here. All right. And then I'm just going to check your neck area to make sure you don't have any discoloration. And then I'm just checking both sides with the back of my hand, just checking your temperature to make sure there's no spots of cold or if there's any spots where it's hotter than the other. Have you had any problems with tenderness around your chest area?
Yeah, around my period.
Okay. And do you usually do self-exams on yourself?
I do, yes, on my boobs.
And how often?
I want to say 2 times a week.
Okay. And have you noticed any changes, any lumps that weren't there before? Any tenderness that might have started out of nowhere?
Just tenderness, but it's mostly has to do with my hormones. and my
Okay.
period.
Okay. So what I'm going to do is I'm going to use my fingers. I'm just going to pinch your skin.
Mhm.
I'm checking to make sure that it recoils fast. Sometimes if it recoils a little slower than it's supposed to, it can mean that you're dehydrated. But it's more often long-term dehydration, not dehydration of you not drinking enough water today. It did recoil fast, so you don't have any signs of dehydration. So I'm just going to check your arms next.
Okay.
All right. And I'm going to do the same thing I did on your back, using the back of my hand to check the temperature difference. And then I'm going to check to see the hairs on your arms to make sure they're distributed the same. Okay. Do you shave your arms?
I do.
Okay. And have you noticed any new bumps or bruises on your arms?
No.
Okay. And I'm just going to check your fingers to make sure they're the same temperature, moisturized. You moisturize very well.
Oh, thank you.
Okay. And then I'm going to check your nail bed. So what I'm going to do is I'm going to press on your nail bed and I'm going to check to make sure that it blanches. It's just to make sure that you're getting circulation to your fingers like you're supposed to be. If it was a little bit slower than usual, it could mean decreased circulation, but your nail beds are perfectly fine. They blanch as they need to. Do you have any eczema?
I do have eczema.
And where exactly do you have your eczema?
Right there.
Okay. So I do see. And do you have it on this one too?
I don't, only once in the blue moon,
Okay.
especially in the winter.
Okay. Absolutely. So you just gotta, like you said, when you have eczema, you have to do a little more with your moisturizing process. Some people think you have to just put lotion on. With eczema, you have to do a little more. Sometimes the heavier creams work better than the light water-based creams. So just something to think about. So I'm gonna check your stomach.
Okay.
And I'm just checking for any discoloration. And do you feel any tenderness when I do this? Okay. Have you noticed any nodules? And what I mean by nodules, I mean like bumps or anything like that?
Bumps? No.
Okay. Alright. And as far as this little rash here, how long has that been there?
About 4 days.
Okay, and has it changed? Does it look like it's getting worse or getting better?
Looks like it's getting better. It was red
Before?
before, now it's
Okay.
purple.
And was it open before?
No.
And they were just exactly the way they are now?
Yeah.
Okay.
It's not sore, itchy.
Okay, that's good. And have you did anything as far as put anything on it the past few days, or you just left it alone?
I just left it alone.
Okay,
Do
that's
my
good.
normal thing.
Okay, that's good. So I'm gonna go to your legs next. I'm just gonna roll this up just so I can see both legs.
Do
Alright.
you see this often?
Not often, but like I said, sometimes our bodies are different from others. So sometimes something that could have irritated someone else might not irritate you. So you could have went over someone's house and you could have wore their clothes and they use a detergent that can cause a rash and stuff like that. So it's not always one thing, you know. Sometimes it could just be irritation. Sometimes it could be something further. So that's why I'm asking you how long and if it's getting better or worse. The
Okay.
things that would raise concern for me is if it was itching or irritated or if it was painful. You said it was none of those and it wasn't acne spots prior, so it doesn't raise any other questions. It could just be irritation. Or just a
Irritation.
rash. Yeah.
Do spider bites look like that?
Often no, unless multiple spiders bit you in the same spot. It would usually be like 2 dots with like maybe the black head in the middle.
Mm-hmm.
But I wouldn't think it's spider bite.
Wait, can you get a disease from wearing other people's clothes?
Not a disease, but like as far as detergent, like people
Okay.
use different detergents. So, If someone uses Downy and another person uses something else, it can irritate your skin because your body's not used to it.
Of course.
So that's why they say, just bring something familiar with you when you go to people's house. If you sleep at their house, bring a blanket that's yours so that your body knows, it's something of theirs.
Interesting. Okay.
Did you fall recently for this bruise, or?
No, but that hurts.
It does hurt? Okay.
I don't know. I got that.
Do you usually bruise easily?
No.
No? Okay. You could have bumped something that you weren't aware of. Sometimes it takes our body some time to react to certain things. So now I'm just placing my hand over your legs to make sure temperature-wise it's the same. Your feet are freezing.
Yeah.
Do they usually freeze?
Yes, they do.
Okay. And do you do leg massages with your feet and stuff like that?
No.
Okay. Sometimes what do help? Sometimes it just might be blood pooling at the bottom of your feet. So sometimes doing a nice foot massage upwards can help with that.
Oh, really?
Yeah. So, and then I'm just going to check your legs to make sure hair-wise it's even, and you just shaved, right?
Yes.
Okay. Looks good. Doesn't look like you have any bruising. Do you have eczema on your leg too, or just your arm area?
Just my arm area.
Okay. And do you ever have any pain in your legs or cramping or bruising that just comes and goes?
In my feet, sometimes it just cramps up.
Okay.
Like I'll cross my legs and it'll cramp up.
Cramp up, okay. And how long does it usually take for it to stop cramping?
I literally have to stand up and put pressure onto it.
Okay.
Because my fingernails literally cross.
Okay. And does it
And
usually
get stuck.
happen? Does it usually happen with long-term sitting, or is it just?
Out of the blue,
Okay.
I'm dying.
Don't look at Google. So now I'm just gonna check your nail beds.
Okay.
I'm just checking to make sure the same thing I did with your fingernails, just to make sure they're blanching and stuff like that. Just to make sure you're getting proper circulation to your toes. Have you noticed any change in your nail bed thickness? Has it been thicker on one side than it was on the other?
I'm not sure because I get my nails done.
Okay.
They haven't said anything about it.
Okay. I like to ask because sometimes it can cause awareness for like diabetes. Elderly people usually do have problem with the thickness of their nail beds just because of diabetes and stuff like that. But
How else would you know if you have diabetes?
there's other things like you might have moments where your blood sugar just shoots up. And there's things that you can tell, like your breath might smell fruity. Sometimes you can just have moments.
Your breath smells fruity?
Yeah, but that's for like something where it's like emergency diabetes. But most of the time your doctors would usually do little tests on you throughout which you have your yearly exams to let you know if there was any cause of problems or anything like that.
Okay.
But your toenails look good. Alright. Does this hurt at all while I'm doing this?
No.
Okay. Alright. So,
Should I stand?
yes. Alrighty. And I'm just checking the back of your legs just because you were sitting and weren't able to check. Does this feel tender at all that I'm pressing on the back of your leg?
A little bit because I was working out most likely.
Okay. And then you just have little like razor bump looking area. Do you shave the back of your legs?
I do, yeah.
Okay, so it can be from that.
I'm very heavy. I have to.
Whatever works for you. But everything looks good today. I didn't see anything that raised me to have any concerns. You said that most of your pimples or your moles and stuff like that are things that you know that they're there. Nothing was raised, nothing was tender, nothing was, irritating that caused me to want to look into it further. You look pretty good.
Awesome. That's good to hear.
But thank you for letting me do the skin assessment with you today. If you
No
have any
problem.
questions or concerns, please let me know, okay?
I'll give you a
All
call.
right.
Thank
Bye.
you. Yeah.